professor, physician, epidemiologist. I am Dr. Shree Banerjee. Hello, I'm Dr. Shree Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And in this video, I'm just quickly demonstrating how to enter unique data points from a study and then provide a distribution within the map. So for starters, the map that I've generated is actually a distribution of individuals that have reported poor mental health within the previous 14 days. So here you can see that there's a pretty it's a pretty considerable distribution of poor mental health. And as you can see, the light purple, if you take a look at where those are the areas of poor mental health, more so. So you can see also on the legend, and again, the link will be provided for you to visit. But you can see in the legend all the different types of diagnostic criteria and diagnoses that were present during the pandemic. Due to the fact that early on within the pandemic there was no kind of standard measure to try to diagnose, there was no quick tests available. So as the pandemic continued, COVID-19, as scientists understood it better, then they were able to create more accurate and more rapid diagnostic tests. So one additional point that I would like to make over here is that it's not only important to understand prevention when we're thinking about public health and healthcare, but it's also important to put as much emphasis in after the diagnosis has taken place, and even during diagnostics, what are the measures that are needed to definitively diagnose the disease, and then the management after the disease has taken place. What actions to take. So in this situation, the point is that diagnostics can be complicated, and so it was not only important to know people that were tested, because there's a lot of false positives. So sometimes, so the blue actually shows not only testing positive, but also so blue is testing positive. So if you look at the distribution of blue, and there was one in Arizona, Texas, so there were quite a few that were definitively positive. But then when you looked at those that had suspected, and also potentially currently live, they might have not tested positive for the disease, for the virus, but in fact they were asymptomatic. So how did we go about creating this map? I'm going to show you some quick steps. This can be created from the free edition of ArcGIS, or if you have a paid subscription. So what I'll show you here, what is the most important here, is that this is a technique which you can apply to any sort of mapping situation when you have specific coordinates, and they don't have to be specific geospatial coordinates, latitude, longitude. They can be any types of geographic information. So it could be zip code, which is in this case what I used. It could be county level. So what you have to do is go in and designate them. So in this segment, let me now show you how precisely to organize these layers and then edit at each layer. So let me go to content. Right now you're looking at, here's the menus here under details, and right now you're looking under the menu legend tab. So let's switch over to content, and under content I've already uploaded multiple geospatial files, but I'm going to show you again how I kind of backtrack and show you what I did. And then there's the base map, and then another map that I'm overlaying this on, where the spatial join was created with, and that is the county health rankings base map, where I'm displaying the mental health status in the last 14 days. So what I'm going to show you now, pay attention to this, is how to import CSV files as a layer so that you can create spatial joins. So I'm going to hit add, and then we're going to look for add layer from file. So once you go in here, you can choose file. And right at the top here, there is a geospatial file that is showing, and that is the one I'm interested in. It's a CSV file. Actually, it's a Microsoft Excel CSV file. Make sure. There's certain formats that are acceptable. GeoJSON files, those are really common sort of files in geospatial world. You can also use the GPS exchange format, but in this situation we're going to use CSV. So here, import layer, and now what do you have to do? Just take a quick step here. I have a field called primary postal code. Go ahead and select what this is. So before that though, let's backtrack. Locate features by coordinates. No, we're not doing coordinates. We're looking at addresses or places. So this is within the United States. And now you can designate this as zip code. So I have two zip codes here. Longest zip code and primary zip code. And then there's two other variables, so we're going to be using that in a second here. So this was a success. Not all features were added, but the ones that have been is being shown. You can hit OK. And so this is displaying now. And so these are the different designations. You have the option of having single symbol or unique symbols. In this case, unique symbols work best. So then you select done. But when you're choosing an attribute to show, you might not be interested in just COVID status. That's a good location-wise information, but you might also be interested in understanding suicidal thoughts, so that we can then switch over and then take a look at how we can designate that. So there's presence of suicidal thoughts or absence. So this you can see, I'm trying to change the style. The orange doesn't really show much information, so I'm going to switch this to unique. So now you can see it right at the very bottom if you take a look. 0 and 1. So 0 is no suicidal thoughts and 1 is suicidal thoughts. Both of these maps, the first map that I showed you at the beginning and this map, are present within links that I'll provide in the YouTube description. So 1 designates places where there are suicidal thoughts, and the other thing that was interesting to see if there's any correspondence between places where there was suicidal thoughts and past 14 days with poor mental health. So there's multiple patterns that you can take a look at. Let's select done, and then you see there's actually 2 layers that are technically showing, but the one that's really showing is the suicidal thoughts right now. So you can kind of switch it back and forth, toggle on and off certain layers, and then when you're ready to save, you can select save and then share, and you can make it available to everyone that you're interested in sharing your research with. So there you have it. Within this video, not only did we go over some of the COVID social change grant research findings, providing some patterns and geographic distributions, but I also showed you how to create a spatial join from data that you might have collected within the field, or for this situation, or in this case, data that we collected from primary data collection over a number of months regarding the pandemic. And then finally, how to store this map so that you can share it for collaboration. These are the different phases of map creation and how to integrate this into your own research and practice. Thank you for listening.